Hello, I am Nick Harmon, a family physician at Sea Health in Southwest Virginia. The typical day for me is just providing basic medical care for folks of all ages, from newborns through the end of life. I work in an outpatient office, so managing primary conditions, chronic conditions like diabetes, high blood pressure, COPD, and also acute complaints, sore throat, cough, low back pain. Uh, there are lots of other positions within my office, different nursing, LPN, RN, nurse practitioners, there are phlebotomists, x-ray technicians, ultrasound technicians, and then the front office staff. For me, I did 4 years of undergrad education and then 4 years of medical school, and as a family medicine physician, then you do a 3-year residency. Throughout undergrad, I did shadowing in the different areas of medicine that I thought would be of interest to me. Some folks will start that as early as high school. I was kind of late, so I didn't do any of that until undergrad. Some of my classmates also worked for the EMT or paramedic squad while they were in high school. There are lots of rewards that come along with my career. As a family medicine physician, you really get to know truly the whole family and form some bonds that I don't feel like you get with any other profession. From grandparents to the little children, you get to know everybody, and everybody wants to come in and see you even when they're not sick. There are lots of challenges that come along with medicine. We have the medical record that requires a lot of our time, that will take away some time with patients. We have to do a lot of paperwork for insurance companies, and obviously right now with the opioid epidemic, we have to kind of meet that as the front line as primary care folks. The average salary in Southwest Virginia, it really depends on where you're working as a family medicine physician. As I mentioned, you can do outpatient, which is where I'm primarily focused. For most of those, the average is probably $150,000 up to $180,000, maybe a little bit higher with bonuses. If you're more willing to work in the urgent care or the emergency room, then you may be able to make a little bit more, upwards of $200,000, depending on where you're at and how many hours you're working. As far as opportunities for employment right now in Southwest Virginia, I think that it's still a growing field. There's not as many people to see, but there's still a huge need for primary care in our area. There's lots of opportunities to come back and help folks out in this area. And some of the hospitals will even provide sign-on bonuses and help with some loan repayment if you're willing to come to a rural area like Southwest Virginia. And as I said, I'm Nick Harmon, a family physician, and I encourage you to pursue a career in our Southwest Virginia.